Mini tummy tuck with muscle repair. So, sounds simple, doesn't it? Yeah. So I've just said about the muscle repair. So when your rectus abdominis muscles, your six-pack muscles, when they get stretched, weight loss and children, the two things that do it, they can become slightly apart. Say we call it divarification of the recti muscles, and that can create a bulge. Now that bulge is usually above the belly button. So, and at a time of a tummy tuck, a full tummy tuck, we go up above the belly button all the way up to the rib cage. We have to do that in order to get the wound closed, and we usually would repair that divarification of the recti muscles. The problem is that when you have a mini tummy tuck, you don't go above the belly button. That's the problem. One of the benefits of a mini tummy tuck is you don't get a scar around the belly button, which you get with a full tummy tuck. You get a shorter scar in the lower abdomen, and you don't get a scar around the belly button. So that's a benefit, because people say, do you want a scar on your belly button? Well, no, I don't really. Thank you very much. So it's a benefit of a mini tummy tuck. But because you don't make a scar on the belly button, you don't go past the belly button. You don't go north of the belly button with a mini tummy tuck. So you can't get to the muscle above the belly button, and it's usually the muscle above the belly button that's the problem with the bulge and the divarification. So if someone's asking for a mini tummy tuck with muscle repair, they've probably got a bulge above the belly button. So it's difficult. Now, I haven't said it's impossible. It's difficult. So it could be possible by doing what we call floating the belly button. And that means transecting the stalk of the belly button, cutting the stalk of the belly button. And then you can sail past and go up underneath like a submarine, underneath the skin, and get up north of the belly button. But that means you've floated the belly button. The belly button will then pull down. And then if you did go on to have children or put on weight or whatever, and for any reason want to have a full tummy tuck, then the belly button would probably die if you cut around it, because it's been transected at the stalk, and it's only attached to the abdominal wall by scar. So you would have to make sure that you had, as a surgeon, you'd be aware of that if you're doing the full tummy tuck in the future. And even if you did float the belly button, even if you did transect the base, it would still be difficult to get up there, to get up to the rib cage, because you're starting from way low down, and it would still be difficult. So that's the only way you could do it, potentially, by floating the belly button. But as a sort of soundbite, the easiest thing is that you can't have muscle repair with a mini tummy tuck. That's the easiest thing to say. But if you say, look, I really want a mini tummy tuck with a muscle repair, then it could be possible, but it's not easy. And but it's an interesting concept, an interesting, if you haven't got, because some people haven't got enough for a full tummy tuck. Some people just cannot have a full tummy tuck. You may not be a candidate for a full tummy tuck. So I understand where you're coming from, because if you can't have a full tummy tuck and you need a muscle repair, where do you go? What do you do? Mini tummy tuck with muscle repair. That's what you do. But as I say, it's difficult.